Hello everyone, I am Dr. Nikhil Chanduri from Radical Homeopathy. Today we'll discuss on the sexual disorder people are facing in day-to-day life. So sexual disorders are completely based on hormonal imbalances in their life, and these factors are also included on stress levels and tensions they are facing in day-to-day life. So sexual disorders are completely divided into three phases on my personal experiences. So I'll divide into three stages. First is premature ejaculation, second stage is partial erectile dysfunction, and the third stage is erectile dysfunction. We'll discuss on the first stage, that is premature ejaculation. Premature ejaculation can be described as if you're trying to have sex, and we cannot include as foreplay, if you try to insert and if you do not stand for a period of 2 minutes and your sperm releases before 2 minutes itself, this is considered as premature ejaculation. Second stage is partial erectile dysfunction. Partial erectile dysfunction is whenever you try to, when you're trying to have a foreplay, your penis have a good stiffness, but when you try to insert in, the penis drops its stiffness, and this condition is called as partial erectile dysfunction, and you don't get complete stiffness on your penis. So this can be considered as partial erectile dysfunction. The third stage is erectile dysfunction. Whenever you try to have sex, and if you have forcefully tried for this arousal, so you can't get it, erectile dysfunction. So you don't get stiffness. So this condition is considered as erectile dysfunction. So there are many causes for this sexual disorders, but mainly considered as stress in your day-to-day life, tension, pressure, and work pressure. These are the main conditions for sexual disorders. So we'll discuss the causation for these sexual disorders in your day-to-day life. Whatever may be the reason, in day-to-day life you'll feel family issues, office pressures, tensions, and all these factors lead to all these sexual disorders, and people don't tend to realize you're facing all this stuff. Premature ejaculation, partial erectile dysfunction, and erectile dysfunction. People tend to have feeling of shyness, and people don't realize whom to consult to a doctor. So you can consult a sexologist nearby you for these problems. Okay, and previously for all these sexual disorders tend to be seen in an age period of 28 to 40 years of age group, but in nowadays the circumstances have been changed a lot, and the stress and tension level has been raised a lot. So nowadays people are having a sexual disorders of 15 to 30 years as well. So the causation for these all factors are included in your sexual life as well.